trickling in. So why don't we just go ahead and I'll start introducing everybody, and then I'll turn it over to you. So for the folks that are listening, we can't see you guys, but you guys can see us. We have with us here Dr. Nace, and I'm going to allow her to introduce herself here in just a minute. But we also have with us Kim Fontaine. She's our occupational health nurse. She's the one that most of you have probably been talking to in regards to your own needs around testing and leave and all the questions you have about being symptomatic or returning to the workplace, or all those sorts of questions that you have. We also have Brandy Wayner. She is our risk management liaison and oversees Kim and is responsible for the COVID response team here for our district. And I believe that Andy DeGraw is going to be signing on as well in case there are any questions. So with that, I'm going to turn it over to Dr. Nace, and she can give you all of her expertise on N95 masks.
Okay.
And then when you are ready, we will play the video. Just let us know.
Sounds excellent. Okay. So my name is Michelle Nace. I'm a pediatrician at Tanana Valley Clinic and Fairbanks Memorial Hospital. And I've been working with the school district over the past, I don't know, COVID times, trying to figure out the best ways to make things better from a medical standpoint, and being there for advice, as well as to kind of walk through this process with you. And so there are different things that through the course of this pandemic that have come before us that we need a little education about figuring out. There are so many things I've learned and relearned, and then learned what the CD said, and then relearned what the CD said, and then wait, no, now we're doing this. So the thing that we've definitely learned in COVID times is anything that you learn, there's a good chance that there's going to be different, more, or additional advice. Not meaning that the decisions and the choices that we made at the time were wrong. They were just with what we had with the best knowledge at that time period. And as we acquire more knowledge, more study comes through, we learn more things. So there's been a lot of talks about different kinds of masks. We've had different mask talkings, and we know a whole lot more about masks than we did 9 months ago. When we first started talking about masks back in April, May, all of those time periods, we just said, put something over your face. We didn't know exactly what that material was. We didn't know exactly where we were going to get it, where there's mask shortages. Now fast forward to 2021, and we have a lot more information regarding it. So the types of masks that we're going to talk about today are, one, the N95 masks, as well as some other masking options that could help you in your job as it currently sets. So the first one is I'm going to go through is an N95. And so the N95 is probably what we would call the gold standard of masks, but it doesn't come, it's not, it comes with a little cost to it. And so I want to go over some of what the pros and cons of the N95, and then also how to wear the N95s. That being said, when you get an N95, and I'm just going to show you an example of one. This is an N95. And the biggest difference between your basic N95, and a lot of this you guys already know, I'm going to go over it just to make sure that we all are on the same page before we start. So you have your N95 mask. You have what we call like a medical mask. You see these now all over Fred Meyer's or Walmart or where else. And then you also have your like cloth masks. And just these are the ones that people made at home, but now there's a lot you can just kind of buy online. So when we talk, different masks are for different areas that have depending on the type of coverage that you need. So an N95 is what we use in the medical setting. And even in the medical setting, I frequently will just use these. I use these under certain circumstances, under certain points, because when I put it on, I can't wait to get it off. So you'll see a group of us all dealing with something that we need to because the risk is higher. We'll put these on, but we are looking at each other saying, I can't wait to get out of the room and be able to put on another type of mask. Whoever thought these things felt so good? These things used to be something that you put on there and you couldn't wait to get them off. These make these feel, these make these feel wonderful. So, but you do get extra protection. So these are super important to be able to wear. So I'm going to go over with you how to make sure you have a good fit, how to put it on, and some considerations to think about to find out what is the right mask treatment for you. Wearing. So the other thing is the CDC came out with a bunch of new recommendations. I'm going to go over those too regarding double masking and different things you can do to make your mask more effective. So the N95 here, what it is made of synthetic fibers that instead of just kind of in a regular row, they're all randomly parted there and they're electrically charged. And so what happens that is as particles come through, there's a whole bunch of different things that help protect you as the wearer. It protects you by the fit because it's nice and snug around your face. For the filtration, because of the many synthetic fibers are there, as well as that little electrostatic that kind of pulls particles in to make it set. The 95 part of it number represents that about 95% of those little particles that are trying to get through are not going to get through. So it's a 95% effective from those particles. Your medical mask, you're going to see some different numbers, but somewhere in this, it's properly worn in like the 60. Be like a N60 if you want to call it that. So it's not as effective. It's still effective, but it's not as effective as this. But here's the things that you need to be careful about with the N95. So first of all, you're going to watch a video in just a second. That's like a 2-minute video that's going to go over how to wear it. And I'm going to have you see that first, and then I'm going to show you the pluses and minuses of it. So Ivory, if you could show that video of how to put on an N95, and then we're going to reemphasize some of the points there in the video.
All right, Teresa is going to load that up for us, so she'll do that here.
Okay. So this is just I'll just talk while it gets ready so you can start it at any point. This is just a 2-minute YouTube video that shows someone who is putting it on and showing how to do a simple kind of fit testing to make sure, is it making a good seal on your face? They come in different sizes. So depending on which kind you were provided, you might need to go up a size or down a size or a different brand that doesn't work. We'll have to see what depending on what kind of fit test you have. Do I need to start it? There's no volume on there.
I was just going to ask, is there sound?
Yes.
Prior to donning your N95, assure your hair is before donning mask, perform hand hygiene and don gloves. Prior to donning your N95, assure your hair is tied up. Make sure no makeup is worn, as this compromises the mask and it cannot be decontaminated or reused. Ask a coworker to assist or use a mirror to check the placement of your N95 mask. The mask and bring it up to your face. The mask should sit center on the bridge of your nose. Most masks seal best when they are high on the bridge of the nose. Bring the top strap over your head and place it just above your ears. Then bring the bottom strap over your head and place it just below your ears. Without touching your face, use 2 fingers from each hand and gently mold the metal bar to your nose. Do not pinch or poke, as this causes peaks and makes an improper seal. Now perform your seal check by placing your hands above and below the mask without touching your face or eyes, and blow out forcefully. Assure you do not feel air escaping around the borders of the mask with those breaths. If you do not feel air, you are now good to go. If you did feel air escaping, you may have to move the mask up or down and perform another seal check. If this does not work, you can crisscross your straps to make them tighter. Before adjusting the straps, perform hand hygiene. Slightly lower the upper strap, then raise the lower strap to cross over the upper strap. The straps should be crossed just above your ears. Perform another seal check to assure proper fit. If you still cannot get a proper seal, please seek out your supervisor. If you do have a proper seal, perform hand hygiene and you are now free to do patient care.
Didn't she look super happy putting that mask on? So the things that the video don't mention is a couple of things that can keep you from getting a good seal. One is that any facial hair. You might have seen some of the doctors and some of the clinical staff last fall or last spring when we got down the N95 that they had to shave off their beards. You can't be fitted appropriately with an N95 and get all the benefits without shaving off the facial hair that might come and prevent a seal. So that's one consideration to have. The other thing is how it feels to wear it. It is a little bit restricting. And so it is not as comfortable. And because it's not as comfortable, people tend to want to take them off more. When you take them off more, you are exposing yourself to what's on your mask, as well as the breathing, because you just feel like you might need a breath different than you would using a medical mask. So in some areas, actually having an N95 is not as protective because it's not as comfortable. People are more touching their face, readjusting it, and also taking it off. So you want to consider those things. If you put an N95 on it and you feel this is restricting, this is not comfortable, I can't keep it on, an N95 might not be for you to wear. So I'm going to give you some other alternatives that people have found work. One is the double masking. And so double masking is a newer concept, and the CDC has done some studies and gives you tips about how you can double mask. Now, when you're double masking, there are some do's and don'ts. So a double mask, you want to use a medical mask, just like you can get over the counter. They cost like 20 cents each or so. And you're going to put that on first. That's the one. So what's nice about this is the filter there, and they have the nose piece. What is not ideal is they don't mold around your face. So with this on there, you get, that's your first layer. So you're putting this on there and you're putting it up here on your face like this, molding your nose. And of course, as they said in the tape, anytime before and after you're doing any of the things with a mask, you're performing hand hygiene. For this video, I'm not going to be doing it every time, but that's what you want to do. Anytime before you're touching and putting on, and every time after, you would be doing hand hygiene. And then the second time would be on over top the medical mask is your regular mask that you get, your cloth masks. So this can be, usually these are 3-ply. Most masks tend to be 2-layered, some are more. And this is going to pull your medical mask closer to your face to cut off the areas that may be open, which are allowing particles in it. And the two of them together give you that tighter seal by pulling it in and giving you more coverage. And so I'm going to take it off so you can hear me talk. So the double coverage, they are finding in the studies that the two of them together can get you up to about 95% as well, depending on the fit that you get. So you're getting a lot of coverage with that. Plus it's much more comfortable. This weekend when I was at the Carlson Center doing vaccinations, I wore the double mask all day to see how it would feel. And when I put it on, I definitely noticed different than just wearing the medical mask. But throughout the day, then I didn't even realize that I had them both on. And so it wasn't increasing more uncomfortable than wearing just one mask. Now, the other trick you're going to see if people are just having the one mask is the ear loop hack. And what this is you're going to fold it in half you're trying to get rid of the space that's on the side by folding your mask in half, tying them in a round knot and getting that knot as close as you can right to the mask, and doing that on both sides. This is taking away some of the space in which which particles can get through. And so you want that knot to be as close as you can in there. So essentially what you've done is made that mask more shaped like what you might see. And you want to tuck in the edges so that they go inside. There are a lot of great videos on how to do this on YouTube that take just 2 minutes to watch. You have those on the inside there. And then when you go to put it on, you're going to see what happens is I still have the nose piece on the top. My ear pieces go here, but it's shaped a little bit different after I fold it in there. So I still have good coverage, but now I have more coverage on the sides. And so it flums around there and gives you, and it's much easier to breathe through. And if you watch, that air is staying inside there. I look like Darth Vader. That is staying in there, and that gives you better coverage than when I wear my medical mask, which won't get the same kind of coverage. Even though it's on there, it still has spaces. You don't get the same kind of coverage for this area on the side. So that's a trick to do with just your single mask on there. So that also the CDC has come out with offering guidance on the two. You have your extra layers of the medical mask. You have the tightened up against your face. And then they also, as we talked about, the double mask. Now, there are some double things they don't recommend. They don't recommend putting on a cloth mask and putting this over top. This doesn't help because this is not conforming to your face, whereas most homemade masks conform more to your face. So they pull that medical mask down. So that's the recommended order, and that's in which the studies have been done. Medical mask first with the nose piece, and then your cloth mask over top. There also are no recommendations to saying using your N95 and then putting something over your N95 to make your N95 fit better. That's not the purpose of the N95s or the KN95s. And some people ask, what's the difference between these N95s and the K95s? It's by what country they're made in. So N95 is a company of the United States, and they have their standards. And so that's what they call them when they're approved by a United States company. The KN95, which I don't, is a company out of China that makes masks that still have that 95% particles are taken care of, but they don't have the same stamp of approval that you get from the United States. Those have been more easily to come by. Their production has been a higher number, but there are problems in that there have been a lot of counterfeit masks that have been out there. You think you're buying the right ones, but they are not the ones that are approved. If you look at the ones that are N95s, they have a seal of approval. You can see on there, it says NIOSH. That means that they have been approved. And the ones that come out of China also have a seal of approval that will say what they are, but those are easy to counterfeit too. So sometimes it's difficult to say. So the recommendation is to buy them from a reputable company who's already made that process and guarantees that they've been sent out. The pricing can be different, of course. And so sometimes you do pay more for the ones that are guaranteed to actually have the right particle and material on there. Additional recommendations, outside of wearing the N95s that can transfer your mask are wearing your mask with what's called a mask fitter, or even rubber bands that are made that can go on top of it. I don't have a mask fitter, but what this is you're wearing your medical mask here, and it's a rubber piece that goes on top and hooks around your ears, and it just forms a round circle around your mouth. And it's like one rubber band here, a rubber band hooked to your ear, and a rubber band hooked to your other ear. And it just pulls your mask, your medical mask or your cloth mask to your face. And that's what it's about, getting that tighter seal. And those are out on the market. And there's also great YouTube videos about how to make your own at home as well. There's also a nylon cover, which is just like a nylon off of stockings, that you can wear your mask and you pull up a nylon cover and it molds that mask right to your face. And those are options as well. So to sum it up, there is the offer of N95s out there. They come with positive points in that, yes, they do filter out that 95% and are effective when you get a good seal. The downsides are that they aren't as comfortable. They can feel kind of restricting. It's difficult to get that fitting if you have any facial hair. And ideally, they have to be fitted and sized to you. So we've given you some recommendations about how to size them and make sure they're fit for your face. If you do those tests and feel you can't get a good seal, you need to reach out and get more help. And that would be with, I believe that would be with you, Kim, saying if they have more assistance, and we can see if we can help figure out how to get you better and fit tested. A lot of people are able to find their fit and feel comfortable with that. But if you do not feel like this is fitting and this is the right one for you, you need to reach out to get that extra help for fit testing. But also wearing the others factors are also options. The last I'm going to call is a hack. This is you know how they have life hacks. This is a mask hack. A lot of people have masks that they really like wearing, but they don't have that nose piece on them. And so I have found that I can take a mask that I've already used and doing hand hygiene, can take these things that you shouldn't run with, scissors, and you just cut off the top part of this and you'll find this cool little thing that pops right out. And it's the nose piece right here. And then I have a half a dozen of masks that I've modified, of masks that I love that look just like this because they're great for running. All you do is you take your scissors, you make one little tiny cut right there. You take this, which came out of the disposable mask, fold it over to make a loop, and you slide it right through that seam. And it stays in there. You can wash it still in there. You get a little hole that's right there, and you can see that hole, but it's super tiny. And it goes in there, and I've transformed my regular mask into one that I can make that go over my nose so it doesn't fog up my glasses, and I'm able to wear it. So that's my Dr. Nace disposable hack. And then I'm doing hand hygiene. So that is kind of the how to wear a mask, how to fit it. The last point all day is when you're taking it off. You saw when she was taking it off, you want to take it off and what you're going to do with it. We put them in what we call the clamshells. We'll put it off when we take our masks off. We're putting them right in the clamshells to let them air out, and we'll put them with our name on it so we don't lose who they are. Other people will do things and hang them up to kind of let them air dry and to use it. Ideally, N95s are geared to be single use, and that we would go through multiple in a day. When we're in these times where they're not as accessible, we've altered that a little bit about how you use it. So there's two things. There's extended use and there's reuse. Extended use is when you put it on, you leave it on all day for a long period of time, and you don't readjust it. So you're not touching it, you just leave it on there. And then there's reuse, which means you put it on, you take it off after the episode you need, you put it away, you bring it back, you put it on again, you put it away, doing hand hygiene before and after, and that's reuse. Now, normally that's not the recommendation. However, in these times, we have leaned over to make sure we preserve so that we have continued supply of N95s and use these as long as they're not soiled or damaged, we will use them. So I don't know if there are any questions specifically that you wanted. I'm going to perform some hand hygiene right here now while you figure out if there's any questions.
Right. The first question that came up, if anyone has any questions, feel free to drop those into the chat. And I'm going to have Kim Fontaine talk next about how to access the N95 mask if you want. But one of the questions that came up, frankly says that the N95 masks are not practical for a school setting. So why are we getting them? We came to an agreement with ESSA through our negotiations to provide a limited supply of N95 masks for certain staff in the school setting that wanted them. So we do have a few employees who have expressed interest in wearing them. We held this session with that intent so that folks knew what they were getting into with the N95 mask, the appropriate use of it as well, and providing that information as much as we can to folks. I think that, I didn't know much about N95 masks as well. And so I've learned a lot over the last few weeks about them. And so we wanted to provide that information to folks as well. So the first-
Can I piggyback on that just real briefly, Ivory?
Yep.
So Ivory mentioned provide a limited quantity to specific areas of our ESSA support staff. Those specific areas are special education personnel, a lot of which are working in the trenches with students, nursing personnel, in the schools. Anyone who's participating in a deep cleaning team in the FMD department. So if you're participating in deep cleaning of rooms that have had, that need to be deep cleaned, specific employees who are specifically over 60 years of age, and then any employee with a specific documented health condition that puts them in a high risk category. So those are the specific areas of our support staff personnel that we have identified that can have access to the N95 masks.
And the additional comment that came from that is that they're uncomfortable to wear. And I think that Dr. Nace has also touched on that as well. And having never worn one myself, I'm not aware, but I will go by what the experts are saying. And so with that, I'm going to turn it over to you, Kim, to talk about if those folks that Andy just outlined are interested in getting an N95 mask, how would they go about it?
Well, we do have them in the warehouse. There's more coming in all the time. We haven't had a discussion yet about how we're going to get them out to you. I will get back to all of you on that. I don't know if you'll be emailing me and I'll send it to you, or if you'll be able to place your own orders to the warehouse. But I will get back to you on that.
All right. Are there any other questions? And this is being recorded, so if you need to watch it at a later time, and we can also provide the link out to the video that Dr. Nace shared to help folks that are going to utilize the N95 masks. All right, I'm not seeing any other questions, and our time is up in just another couple of minutes, so I will let everyone go. And if anything comes up, please email Ms. Fontaine, and she can get that information for you, and we'll email you. I'm hoping by tomorrow we can email you directions on how to get the masks, because we have the names of the folks that are interested in it at this point. So, all right.
I read it should just be considered, it's a tool in the toolbox, and not all tools are geared for every task that you need. So those specifically who need that tool under the conditions they're wearing, then the less than perfect comfort and the cost is worth for that. But if you're not in that area, then there are lots of other tools there in your toolbox that you might grab that are a lot more comfortable, easier to use with a lot more flexibility. So it's just something to think about.
Another question just popped in, Dr. Nace or Ms. Fontaine. How is the mask sanitized between uses?
The mask is disposable, so it's not sanitized between uses. That's the point. That's why this is not a sanitizer. This is a holder, and you're trying to do is that's why you do hand hygiene before and after, and so it's not sanitized.
All right, we have one more minute if there's any other questions. All right, well, thank you everybody for your time. Dr. Nace, to Kim, thank you everybody. And if you have any questions, please reach out and we'll have further information for you as well. Thanks everybody.